Hi, everyone. My name is Becca Bolas, and I am the Executive Director of the Maine Public Health Association, and I am very excited to welcome you all to this joint webinar between the Maine Public Health Association and the Environmental Health Strategy Center, Promoting Health and Preventing Disease, How Public and Environmental Health Work Together. The way that we've structured today's webinar is a three-part panel, starting with Dr. Lani Graham, and then you'll hear from Sarah Rines, who is the board president for the Maine Public Health Association, and then Patrick McRoy, the deputy director of the Environmental Health Strategy Center, will be rounding out today's presentation. And we will take questions at the end of today's talk. You'll notice on the bottom of your screen that there is a Q&A function. If you type in your question there, then I'll facilitate the Q&A at the end of today's talk. So with that, I will turn it over to Dr. Graham, who will begin today's presentation. You should have control now, Lani.
So I'm very glad to be with you this afternoon and to talk about my very favorite topic. And I'd like to begin by putting a question to the audience just to kind of kick things off. So Becca will put that together for you.
You should see a poll now in the center of your screen, which asks you which of these actions is not a public health action. And then if you hover over each of those choices, you'll be able to choose which answer you want.
So how do we
Give
know?
folks another minute or so. We're at almost 30 of 40 votes. About 70%. All right, a couple more seconds, then we'll end polling. All right.
Okay, so most of the attendees got the question right. The correct answer is B. A physician putting a patient on a ventilator is a typical action to save a single life. The other three answers are public health actions that target large groups. So I appreciate your participation. And how do I move this forward?
You should be able to use your up or down arrow.
Yeah, I just tried that, didn't work. Let's see. I'm not, now I don't see the presentation. Shall I give it back to you? Oh, there we go. Okay.
Now, what about now, Lani?
No, it still doesn't want to go forward.
You have to, I'm sorry, folks, you have to accept the control.
Okay. It just offers give up control, but there's another. No. Sorry about this.
How about Lani, you let me know when you're ready to go to the next slide, and I can just do that.
Okay, I'm ready to go to the next slide. So I didn't have control. So I'm ready to go to the next slide. And I don't have any conflicts, and I want to certainly thank Dr. Shah and his troops We are indeed fortunate to have such a wonderful team here in Maine. Next slide. I'm going to briefly be going over public health basics as a foundation for the next two speakers. And since I've always loved history, to say nothing of trying to learn its lessons, there will be a liberal sprinkling of history. Next slide. So this is the classic definition of public health. The leading characteristic is that it's oriented to populations and not individuals. It's a team effort. Everyone participates. And the idea is to create conditions for health, not cure disease. It's about prevention at multiple levels. Next slide. So Hippocrates has always been considered the father of medicine. And as such, many of us took the Hippocratic oath on graduation from medical school. I encourage all of you who may not have seen this oath to take a look. What a fine mind. One of the lines in it goes like this: I will prevent disease whenever I can because prevention is preferable to cure. So I think it would not be unreasonable to consider Hippocrates the father of public health as well as the father of medicine. I sometimes fancy myself a few years ahead of my time. Imagine being 3,000 years ahead of your time. Here he was writing books about relationships between people and their environments, air, water, places, as well as about epidemics, literally epi from the Greek, meaning upon, and demi, the people. So what is upon the people? He understood about infectious disease, but he was also reaching beyond that. And recently I saw a commentary from Jane Goodall wondering if the human race would ever learn the lesson about the importance to our own health of our interaction with animals and our planet. The Chinese still allow live animal markets, and there are many, many more actions that we take every day suggesting our failure to understand our interdependence with animals and our planet. Everything is very delicately balanced, and we really are all in this together. Next slide. So moving on to the more accepted father of public health, Dr. John Snow. 2,000 years later, Dr. Snow figured out that analyzing the environment was the way to go. He figured out that by mapping the locations of sick people in London was a way of determining what was making them ill. He identified water being drawn from the Broad Street pump as the source of infection. Dr. Snow became the first epidemiologist making a profession and science out of the study of patterns of illness. Interestingly, like Hippocrates, Dr. Snow was the father of another branch of medicine, anesthesia. I really like the idea that he was concerned with relieving pain. Next slide. So this rather poor slide is Dr. Snow's map of London and the pump. You can see the dark spots are the locations of people identified as having cholera. He famously took the handle off the pump to stop the use of water. And even today, a pump handle is still the most widely used gift to honor an epidemiologist. Next slide. From Dr. Snow's work, it is easy to see that the first core function of public health is assessment. Information gathering is basic and must be ongoing. We study the data and we analyze it for patterns. When something new arises, we begin with the basics. And it turns out that although disease is theoretically an equal opportunity friend, some people are more affected than others. This has been true for centuries. What makes some populations more affected than others? As we have watched COVID-19 unfold, we have found that people of color are more affected. In other contexts, this kind of distinction has been described as social determinants of health. People who are poor are almost always more affected by illness. crowded together, poor access to health care, underlying untreated conditions. And right now, in the world of COVID-19, people of color are often on the front lines of high exposure areas, such as food service, cleaning, transport, and have employers who have given them less than effective protection. Next slide. So the job of public health for every new problem is to define it. At the beginning of every outbreak, there are always some things we know, but usually there's a whole lot more that we don't know. And it is only through careful research that the unknowns become the knowns. Then comes the question of what to do. So we look at the incubation period. Is it 14 days or 25 years? What are the health effects? What role does the host play? Who is vulnerable? What's the fatality rate? And what treatments are available? And of course, we're still trying very hard to figure out these things about COVID-19. Next slide. So this is the second of the three core functions of public health, policy development. And so easily we go back to that genius Hippocrates, developing policies around air, water, and places. Public health sometimes goes astray on policy development, and it is usually because of some kind of a misunderstanding about the science. The quarantine that we are now using goes back hundreds of years, and on some occasions it has not been used very well. The quarantine comes from the Italian for 40 years, for 40, sorry, not years, 40. And it was the 40 days that ships were kept from the docks when plague was believed to be on board. It was believed to be spread by people when it was actually spread by rats and fleas, who often went ashore without the sailors. Quarantine was also used in the early days of leprosy control in the mistaken belief that leprosy was easily transmitted. Leper colonies were established all over the world, beginning in the 1860s and lasting for more than 100 years. About 8,000 native Hawaiians were forcibly removed from their families and taken to an isolated area on the island of Molokai. Although the practice was discontinued, a few patients continued to live there. Next slide. So the very last of the important public health functions is assurance. And it is the most controversial, and that relates directly to policy development. It usually pits personal freedom against public good. The pandemic is now demonstrating this very well. It is recommended, but not required, that social distancing occur and that people wear masks. Some people are following these recommendations and some aren't. Governor's orders are coming close to requirements, but even those orders are generally without consequence. So we see kind of levels on this slide of ways of assuring the recommendations. Are we going to have recommendations or are we going to have requirements? And in certain instances, such as lead paint in rental housing or child car seats and seat belts, we've gone forward with actual requirements. Smoking being banned in restaurants, and as many people know, there was a huge fight recently about the requirement for vaccination for school attendance. So that's just a brief overview of the basics of public health, and I will now turn it over back to Rebecca Boulos to move on to Sarah Rines. Thank you.
Thank you, Lani. If folks have questions for Dr. Graham, again, please feel free to use that Q&A feature on your screen. And then, like I said before, at the end of the presentations, I will facilitate the question and answer period. And so next we will hear from Sarah Rines, who, as I said before, is the board president of the Maine Public Health Association. And I believe, Sarah, you also have a poll.
Yes, I do. Thanks so much, Becca, and for everyone for having me. But I would love to kick this off as a sort of spur between our pieces, similar to Dr. Graham, having a poll to see where folks are at, really looking at secondary prevention. So I'll let Becca open up the poll to see. So just to ask folks, what action represents secondary prevention between these four options: a seatbelt law, getting your drinking water tested, making sure your blood sugar is controlled if you're diabetic, or placing a person with COVID-19 on a ventilator. So give you a chance to answer that. There we go. We should have some Jeopardy music. Okay.
Give folks a few more seconds. All right, I'm going to close the poll. And Sarah, you should be able to see the results now.
Great, thank you to everyone who completed the poll. So we had an interesting split here between our what actions represent secondary prevention, and I'll give a nice teaser that my talk right now is going to focus on the three phases of primary, secondary, and tertiary prevention. And seeing that we had a slight squeak out here of making sure that your blood sugar is controlled if you're diabetic, from people thinking that is the answer, but that would actually be, we're talking about early detection strategies and things that are secondary prevention. So also focusing on things like getting your drinking water tested and trying to bring those in and thinking about from the standpoint of how we're maintaining and helping someone controlling an existing chronic illness such as diabetes, also fitting within our tertiary prevention strategies. So with that, I'm gonna continue on. Thank you guys for taking the time, because it sort of gives us a chance to know where people are at before we start. And Becca, are you gonna control the slides or am I? Let's see here.
You should have just received the invitation, Sarah.
Okay, you are now controlling Becca's screen. Let's see. Yep, nope. It doesn't seem to want to let me do that, unfortunately. Let's see.
I can see the, can you still see the PowerPoint?
I can still see the PowerPoint, but it's gone back to the original non-slideshow view.
So can you go up to the from beginning in PowerPoint?
I can't click on it, unfortunately.
All right. Why don't you give control feature back to me and I'll advance them for you.
Yeah.
You may be surprised to know we did practice this and it worked seamlessly earlier this week.
We're just trying to keep everyone on their toes and paying attention, and we appreciate you working with us all through this as we all get used to some of the new technology needs and things of remote working and things like that. So I appreciate your help though in moving forward, Becca. Luckily there aren't a ton of slides. Great one. Awesome. So perfect, thank you. So just to highlight, I'm really glad to be able to build off Dr. Graham's presentation, highlight a little bit more about public health. My goal is to be spend the next few minutes looking at more prevention and practices within the public health arena to really support some of those examples and building off the foundation that we just heard about with the core functions. And so if we can go to the next slide, Becca. Just to move into this first, I'm honored to serve on the Maine Public Health Association board with a group of really great individuals from across the state of Maine and working with great staff like our executive director, Rebecca Bolas here. Just to highlight very briefly about MPHA for those who aren't familiar, that that MPHA is a statewide organization that advocates, acts, and advises on critical public health challenges to assure that all Maine residents can lead healthful lives regardless of their income and where they live. And you've got a little bit more information on this slide about the mission and how we're doing that. But I think those keywords, as we talk about supporting residents to lead healthful lives regardless of their income and where they live, really leads into what we're going to be talking about with prevention and social determinants of health, and how those all intertwine into what we're looking at today, and with environmental health components as well. So next slide. Let's go, with the broadly, who is public health? We've talked about what is public health. Broadly, the collective of the public health workforce is focused on promoting and protecting the health of people and the communities where we live, work, and play. And for a lot of us in our different roles, that can look different, but we're all working towards these same missions and pieces to really highlight that. And just wanted to have that second of showing on this list. This is some examples. I actually pulled this down from the American Public Health Association, of their listing of examples of fields in public health, and you look at it and it's broad. It can be a lot of different people, folks who are working in the public health field, whether it's working to track disease outbreaks, and the folks who are working hard at the Maine CDC right now related to COVID-19, or folks who are working to prevent injuries or highlighting disparities and working to address those. There are a lot of different facets in public health. Whether it's from lawmaking on the smoke-free air and seatbelts, or spreading the word about ways to stay healthy, or finding those evidence-based and science-based solutions to problems. But it's really great that we have this wide breadth across the country, but also here in Maine, of folks who are working on this. So I'll go to next slide, please. And with that, there's a lot of pieces similar to what Dr. Graham was highlighting about the core functions, and she hit on slightly the social determinants of health. This is a graphic from the US CDC, and just wanted to highlight a little bit more about that as sort of a basis when we go into prevention of these important lenses that we're looking at this work with. That social determinants of health are conditions in which the environment where people are born, live, learn, work, play, worship, and that all affect a wide range of health, functioning, quality of life outcomes and risks. So that sort of is where I lead back, that already leads back to, where we live, work, and play, and how we're impacting that. But each of the 5 areas that are listed here on this slide reflect a number of key issues that make up underlying factors for social determinants of health. So as we're talking about people when we're looking at it from a variety of different issues of how they all interrelate to impact our behaviors and what we're able to take on. So if we go on to the next slide, it's just and I know that it's a little squished down, but it's those conditions that sort of the factors that can influence your health and impact those social determinants. We look at resources that it can enhance quality of life related to housing or healthy food availability, literacy levels, access to care, the environment around you, that can all impact your health. And when we take at these as sort of those baseline factors, that they can have a real impact with what's going on. So the resources that are enhancing the quality of life can have that significant influence on population health outcomes as well as individuals. So this is really looking at those pieces that are safe and affordable housing, access to education, public safety, availability of healthy foods, local emergency and health services, and environments free of life-threatening toxins. So that, sounds great, but it's sort of how do we get there, but how do we make sure that the public health efforts and prevention pieces that we're working on look at all of this with this as, in the back of our mind, for how it's impacting these pieces and how we're making sure that we're not leaving any parts of our population behind. And so if we go to the next slide here, hopefully it's familiar to a lot of the public health folks who are on the line today, but this is a graphic highlighting the 10 essential public health services. And sort of put the social determinants of health and then public health services as a way that these are describing the activities that our community should undertake really to provide a foundation for those different public health activities or interventions. And they jump across those three you'll see on the outside of what Dr. Graham was talking about of assurance, assessment, and policy development, in pulling these together as sort of our systems approach. But knowing that we need to look at these, whether it be monitoring health status, looking at informing people about health issues, that we're developing policies, enforcing laws, any of the different components as you go around the circle here, that we need to be thinking about these in that, with that social determinants of health lens in the background as a way to sort of pull those together. But just wanted to make sure to highlight this. And if we go to the next slide, Becca, my least exciting slide, which is never great to throw a link right on there, but I just wanted to highlight, if this is an area that you're interested in, that it could be its own webinar or whole course load on, but the CDC has this really great resource if you're interested in learning more about how the 10 essential public health services can be used to address social determinants of health and the inequalities that exist. That they've got a great chart about how across all 10 of those that you can be doing different efforts, that I just think is a really great resource if someone wants to learn more. So, all right, we can go to the next slide. So what is prevention? This goes back to our first question that we opened it up with, that public health focuses on, really prevention of disease and health promotion rather than that diagnosis and treatment of disease. And it can include a wide range of activities and interventions aimed at reducing risks or threats to health. And within that broad definition, there are oftentimes three levels that can be broken down in these areas of primary, secondary, and tertiary prevention. And I think a lot of sometimes what we think of and look at, and what is a big portion of public health, we hit in that primary prevention piece, but really just to differentiate the three, we're going to explore them a little further in the next couple of slides, starting with primary prevention. Becca, awesome, thanks. So primary prevention aims to limit the incidence of disease and disability in a population. So that means we're trying to prevent disease and injury before it occurs. It's really the population broad pieces that we're looking at, trying to eliminate or reduce factors that would impact health and promoting factors that are protective of health. Just to give a couple of examples up here on the slide, we talk about immunizations, smoke-free laws and policies, increasing healthy food options, and we could go on and on about a lot of those great interventions that are happening that are really that population level to impact and really encourage good health and reduce and prevent the likelihood of disease. All right, and next slide. So secondary prevention, as we continue to sort of move up and I think sort of make our pieces a little smaller, this is where we're looking at preventing the progression of disease. I think it's thinking about early detection or early intervention, includes those measures that lead to an early diagnosis or prompt treatment of a disease, reducing the impact. So thinking about secondary prevention is including routine cancer screenings, blood pressure checks, any different components that we can sort of be pulling in to reduce the impact or maybe catch something early on and keep it in the forefront of someone's mind. And if we can jump to the next one of tertiary prevention, just want to mindful of my time here, that as we sort of build up and go from the community up to sort of the smaller groups of people, we're talking about efforts to manage a disease after it's already been diagnosed. So this is sort of trying to reduce the impact of an ongoing illness or chronic disease and its lasting effects. This is done by helping someone manage long-term, often complex health problems or injuries in order to improve as much as possible their ability to function, their quality of life, and their life expectancy. So had some examples here, thanks Becca, of diabetes self-management programs, cardiopulmonary rehab. So this is someone who's already had a diagnosis, but being able to pull that in to really help them in managing their disease so that we can continue to help them have a good quality of life. So really pulling up those three aspects of hoping in our primary prevention that we're creating more, walkable communities, as an example, where people are getting out and about, being able to have good heart health. We're getting in secondary prevention, we're getting their blood pressures checked if they've got high risk factors. And then if they do have, say, had an illness, that afterwards we're making sure they're getting into a rehab program to help reduce further onset. So just highlight that what we want to really encourage you to think about is sort of your work and where that maybe fits within all of this. I always think about if you're a public health professional or environmental health professional, where those efforts and what you're doing and what your community is doing fit into these prevention categories, because it's oftentimes the hidden in plain sight happening right around you. And what's exciting is that, as that continues to happen and we explore more and understand the different categories, we can see how these interventions are promoting and protecting the health of people and the communities where they are living, learning, working, and playing. So if we can go to the last slide here, I just put the quick intersection before I turn it over back to Becca to Patrick. Sort of this intersection of public health and environmental health, which is what we're here for. I want to take a second to showcase some of those intersections between the fields, and to pull it back to a quote from the American Public Health Association that highlights that environmental health is a key part of the comprehensive public health system. The field works to advance policies, programs that lead to promoting healthier communities and healthier environments. So we're excited to have this, collaboration opportunity and see how they work through those same prevention pieces. So with that, I'll say thanks and turn it back over.
Great, thank you, Sarah. And so now we will kick it off with Patrick McRoy, who is the Deputy Director of the Environmental Health Strategy Center.
Great. Thank you, Becca. I appreciate the opportunity to talk to everyone this afternoon. And I'll just let you control the slides. Does that sound okay? Well, okay. After we've learned our lesson there that no matter how much practice and maybe even prevention of Zoom problems we try to make happen, we still have issues. But I wanted to talk a little bit this afternoon about what environmental health is and why it's important and what we can do to further the concept of prevention in environmental health. But because we're good academics, let's start with a little quiz. We got one last poll for you that will highlight some of the issues we're going to talk about today. So I want to know which of these federal agencies has significant public health authorities and responsibilities. Food and Drug Administration, Department of Labor, Department of Energy, Environmental Protection Agency, Department of Housing and Urban Development, all the above or none of the above. I had a professor in college who just gave the most impossible multiple choice question quizzes. They always had the all the above and none of the above. I always thought multiple choice quizzes were pretty easy until I took her class, and you can tell I've been clearly influenced by her. But we'll just let the voting go for another minute, or not another minute, another second or two here. Give people a chance to respond.
We're at about 78% of responses. Folks, another couple of seconds. All right, let's wrap it up, Patrick, if you're okay with that.
Yeah, sounds good. All right, and you're seeing the results there, and 89% of you went with all the above. That was the correct answer that I had intended. 9% saying US EPA, and I would suggest that they actually do have significant public health authorities, although I would also argue that they're not using them very well at the moment, but that's a separate discussion. All right, let's move past that and head to the next slide, which is going to reiterate the point a little bit deeper. I think it's really important to recognize that addressing public health requires the cooperation of many people, and there's a lot that actually protects public health that we don't necessarily think much about. None of that is to take away from the awesome responsibilities and importance of the work done by folks at the CDC and other public health agencies, but there's a lot of other people who are involved in the work of public health, particularly when it comes to environmental health. And I think a great example of that is drinking water, as well as sewer and waste disposal. So providing safe water and safely getting rid of our waste is essential not only for avoiding infections, but for many other aspects of our health. We've seen in Maine in particularly where over half of our families rely on residential wells for their drinking water, and these wells aren't subject to any sort of government regulation. There's no agency is actually responsible for assuring individual private wells are safe for drinking. And as a result, an alarming percentage of these residential wells are contaminated with arsenic, which is usually naturally occurring, or man-made chemicals. These are associated with increased cancer risks and increased risks of learning disabilities amongst children, as well as other problems. And we've also seen many problems happen when we don't dispose of our wastes appropriately. A great example of that last year was a situation at Stone Ridge Farm down in Arundel, where the use of sewer and industrial sludge as a fertilizer contaminated an entire farm with PFAS that ended up in the milk supply, etc. All of these sorts of problems are addressed by a wide range of offices, and I won't go into more detail on why I think all of these are relevant. But I would like to, point out in particular, because I'll hit upon it a little bit more later in my talk, the Office of the State Fire Marshal in Maine is responsible for building codes. And building codes are really interesting in how they influence our public health by controlling the built environment. But before I go deeper into that, let's take a quick look on the next slide at the definition of environmental health. I have up there on the screen a formal definition of environmental health, but really what I want to focus on is that first part. The idea that it's the branch of public health that focuses on the relationship between people and their environment. The idea is that everything that surrounds us that influences our health. And that can include the natural environment. There's a lot of things in the natural environment that can hurt us. There's zoonotic diseases, things that are carried by animals, like rabies has been in the news a lot recently, to vector-borne diseases that are carried by ticks or mosquitoes. Lyme disease, West Nile virus are great examples of that. Those are parts of the natural environment that have a direct impact on our health and well-being. But it also includes the man-made environment. Even before COVID-19 had us sheltering in place, most adults spent the vast majority of their time indoors. And what most people don't recognize is that indoor air is typically more polluted than outdoor air, right? So we hear a lot, especially in Maine, about outdoor air pollution concerns, and those are important concerns that need to be addressed. But indoors, where we don't have as much ventilation, all the off-gassing of materials in our homes and things we bring into our homes tend to build up. And as a result, toxic air pollutant levels are typically higher inside than outside. And this is sort of the kind of impact of everything that surrounds us that we need to be more proactively considering as we think about how to prevent environmental health problems. And if we move to the next slide, I think it's important to recognize that nearly all aspects of health have an environmental component. So if you look at the leading causes of death, heart disease, cancer, stroke, accidents, all of them have an environmental component to them. But what I think many people don't recognize, and maybe are beginning to see more of now with what we're doing in response to the coronavirus, is that infectious diseases also have an important environmental component to them. So, you know, obviously we've all learned the rule of 6 feet of social distancing, right? But in many areas you can't be socially distant because our built environment isn't designed to even allow you to keep 6 feet apart. But it's more about design and space. We're beginning to see the use of sneeze guards being installed everywhere, like in the deli on the photo there, to provide a physical barrier and separation to help reduce the transmission of disease. Less visible, but perhaps also important to communicable disease transmission, is ventilation rate. So there's actually been studies done that have shown the rate of ventilation in a building greatly influence how much airborne disease can be transmitted. You can picture 2 people standing in a wind tunnel, right? And if you have an infectious person who's downstream and they're coughing, that winds will push it all away, and the person upstream from them in the wind tunnel, there's no way to actually get exposed to that, right? So obviously we can't put our offices in a wind tunnel. That's not very practical, but we can change the ventilation rates of buildings, and that has been shown to actually reduce the transmission rate. There's several studies that came out of the 2003 SARS epidemic that actually showed variations in transmission rates in hospitals based upon the ventilation rates. And that comes back to that idea that building codes, which govern regulation, which govern things like ventilation rate, are actually very significant public health tools. On the next slide, I want to highlight again real quick what the burden of environmentally linked disease is. So the World Health Organization several years back actually did some studies to try to estimate what is the impact of the environment on health. And what they found was that about 23% of global deaths are linked to the environment. That's, you know, almost 13 million deaths a year. And those aren't necessarily from vector-borne or infectious diseases associated with environmental exposures. Those are really the same things that are leading causes of death here in America: stroke, heart disease, and cancer. These are conditions that are exacerbated by pollution of our air and water. Cancer is in many cases linked to environmental exposures to chemicals and other problems. And I think as we get into the next slide, what's especially important to think about is the inequity in the distribution of these problems. It's especially important to think about how environmental hazards are not equally distributed and people are not equally susceptible to them. We know that across the globe and in the US, poverty is a major indicator of wellness, and that's not only because of access to healthcare, which often dominates the political discussion in the US, but it's also access to healthy spaces and environments. So we know from the WHO study that low and middle income countries bear the greatest share of environmental disease, but we also see that in the US as well, where systematic racism has really influenced access to healthful environments. And I think lead poisoning is a particularly strong example of this because it's really based upon clear environmental exposures. So most children are lead poisoned in their own home. Deteriorating lead-based paint that hasn't been maintained ends up getting on turning into dust, getting on the floor, and it's hand-to-mouth activity that kids do naturally that ends up exposing them to lead. So in a way, lead poisoning is really an indication of substandard housing. And what we see in the US, as you can see on the slide there, non-Hispanic Black children have lead poisoning at about twice the rate of non-Hispanic white children. And this has nothing to do, obviously, with biology and everything to do with environmental exposures. And as we move to my last slide here, I think it's important to really think about what lead can teach us about primary prevention and what teaches us about the need to invest in systems that are actually health protective. The way we go about dealing with lead poisoning, both in Maine and across the United States, is we test children for lead exposure. So every child, generally between the age of 18 months and 3 years, gets tested for lead. If the child comes up high, we then initiate a public health response, and we go and we try to figure out what is poisoning that child. And it's usually something in their own home. We basically are using children as human lead detectors, right? They're like the canaries that we used to send into coal mines to look for dangerous gases. We send children into housing to identify substandard housing. And I think the question is really, why aren't we instead looking at housing for problems up front? And I would argue, in addition to preventing children from getting lead poisoning, if we actually monitored the condition of housing, we would capture any number of other problems in the home that are causing health impacts. For example, many homes have problems with mold and moisture. That has a tendency to exacerbate asthma or even cause asthma in some cases. We also have many homes that have problems with pests that create unsanitary conditions and also result in the use of toxic pesticides with other sets of risks associated with them. A functioning system would actually try to identify the problems in housing comprehensively before people are exposed to them. And I'll just kind of end by saying I think that is really the goal we should be moving for in a broad sense, whether we're talking about environmental exposures in the home, we're talking about the use of chemicals that have cancer and other risks, or we're just talking about trying to set up systems to manage the pandemic. We want to figure out how do we actually invest in getting to that lowest or that top level of primary prevention and actually preventing exposure to health risks in the first place. So with that, I will end my presentation and give it back to Becca for questions.
Great. Thank you very much, Patrick. So I just want to remind folks that if you have any questions for Patrick, Lani, or Sarah, to please use that Q&A feature in your on your Zoom screen. We do have some information. Here are our respective websites if you have questions or want to learn more about our organizations. I will, there are a few questions already that are in here, so I'm going to read what's been asked. And this first question is not directed to any one of you in particular. We know that climate change will bring more hot days, increasing levels of pollen, more vector-borne diseases, all of which are public health impacts. What role do the speakers see for public health / environmental health professionals in advocating for effective climate action?
Oops.
There you go, Lani. You're unmuted.
I'll take that right away. I think that climate change, from a public health point of view, is one of our leading issues. It might be the leading issue. And I mean, it's potentially going to destroy the planet. And so we absolutely must move forward on that. And my hat is totally off to Greta Thunberg and other young people who have tried to advocate for this important thing. But I do worry that because of economic issues, there's going to be strong resistance to really taking the action that's needed.
Patrick or Sarah, do you have anything you want to add to Lani's answer?
No, I agree with everything Lonnie said, and I think we do need to make sure we highlight the health impacts and use that to help bring along folks who may not agree with perhaps an environmental frame to it. I think highlighting the health impacts is helpful. I would caution, though, that historically public health has not been very successful in getting health protective policies universally through. So it's going to take a lot more than that to actually solve the climate crisis. It's going to take approaching it from a lot of different angles and building a broad range of support, of which public health will hopefully be one.
Sarah, do you have anything you want to add, or are you good?
No, I'm good. I just echo what they're saying. I think this is, we're in a unique time where we need to keep this focus and things on elevating and keeping these issues in the forefront of individuals' minds, and to help use that as our way to make it more than just us as the public health community, that we need this broader sort of social shift to make sure that we're getting that broad buy-in. So just echo what everyone's saying.
I might say one more thing, and that is that in the context, obviously, of the COVID-19 crisis, we've seen massive improvement in air quality as a result of the failure to drive cars or people not driving and not flying in airplanes. And there is a possibility that there could be more of a shift now towards more environmentally smart answers to the energy question. And, we may go more towards sun and wind and, other, and I hope that happens because it's so vital.
Lonnie, you were starting to answer two similar questions that we've had in here, so I'm going to ask them a little bit out of order, just in case you want to add more to what you were just saying. They're both about COVID-19 and how, in a lot of ways, it's increased the spotlight on public health. And what changes do you think we'll see in our field once the virus once it's no longer been declared a pandemic? And then similarly, we've been hearing how much cleaner the air is getting because of the shutdown. What do you think we can do to try to prevent worsening air pollution as we ramp up the economy? And I feel like both of those questions were along the same vein of what you were just adding. So I'm not sure if any of you want to build upon what you were saying earlier to answer those questions.
I can always say more, but I don't want to leave Patrick and Sarah out of this. But I'd like to sort of step to the question of what do we see for public health, and I think now is the time really to ring the bell for public health, because in the past, 9/11 would be a good example. The HIV epidemic would be another good example. There have been brief infusions of resources into public health, and then it falls off. And for the last 15 years, funding for public health has just continued to drop. And poor Dr. Shah, who was a spectacular spokesperson, inherited a situation that was a disaster. And he and his troops have had to take care of this problem in a situation where they really did not have the adequate resources. So I'm hoping that, like Jane Goodall, we may learn from this and invest in public health. I mean, public health should not be having bake sales to raise money for prevention. So that's my soapbox.
Sarah or Patrick, anything to add?
Yeah, I'll just echo that I always appreciate your soapbox, Lonnie. So it's good stuff. But I think it is really one of these ones about we have public health is in the news, is in like this opportunity to build on and find momentum and find ways that, unfortunately, in the situation we're at, we do have a time where we can be educating folks, especially on the difference and that continuing growing sort of piece between healthcare and public health, and how both of the roles are very vital and important in this and other issues. And I think just the more that we can continue to keep that in the forefront, and why all of these different roles that are part of this pandemic response are important in everyday life, I think can be hopefully help us as we continue on to the next pieces.
Yeah, and I would just add that I think the restarting the economy is going to be a challenge. And, I don't think obviously overnight we can, address the pollution that had been causing air pollution prior to the outbreak that simply stopped because the economy stopped. What I do think we can concretely do is advocate for policies that invest in more sustainable alternatives as we begin to relaunch the economy. And obviously, as we head into economic turmoil, there's going to be more action out of DC for stimulus funding. And we should make sure that part of that funding is geared towards what we need to be doing to invest in both public health and climate change going forward. So we should make sure that the stimulus money that eventually comes forward includes rebuilding the public health infrastructure, includes fixing our aging water distribution infrastructures and treatment systems, and is investing in electrification of transportation and other things we need to do to combat climate change.
So building off of that advocacy question, Patrick, there is another question in here about indoor air and indoor health and safety standards in public housing developments. And I mean, Sarah, I know you've done a lot with smoke-free policies, and there are obviously other interventions as well. Can you speak to what some of those policy interventions are, and also what people who are in those that live in those facilities can do to advocate for their own health? Sarah, Patrick, Lani, any ideas?
I thought Sarah was going to take that.
Okay, I was like, I can take it, but I don't know. I was looking at Patrick just from the environmental piece, but I think we know that a lot of it's going to sound like my soapbox. A lot of our health pieces need to start in the home environment, because that is where we spend so much of our time, and especially when we're talking about multi-unit dwellings that have shared, whether it be ventilation systems or different components, whether it be issues of secondhand smoke or environmental factors, that we need to be thinking about policies that can change that. And I've always advocated and seen over time, oftentimes it takes time, but talking and getting, having residents who can speak up to property management and things like that with a clear and concise, here's an action we've seen some success stories with that can help make change. Because I think one of the biggest things I think with policy changes in buildings is that folks are afraid that residents aren't going to like it or like changes that are happening. So showing that you'll be supportive of that change being implemented can help go a long way, especially when there's something when it's going to potentially have an upfront cost, but that people are willing to absorb that.
Patrick or Lani, do you have anything to add to Sarah's answer?
Well, I'm going to add a little bit, just going back to what Patrick had said earlier about not using children as canaries in lead or any sort of substandard housing. And I think that's great. I mean, I was thinking to myself, so Patrick is an idealist. I really think that's a great idea, but we are now that is a typical example of where individual freedom and the right to make money is sort of set against the best conditions for people's health. And it always turns into a very tough environment. And as we saw with COVID-19, people who have the money get the money. And so, getting the smaller person, the disadvantaged person to have a chance is much tougher. But it certainly needs advocacy.
Great. Well, thank you all. There are still several questions in the Q&A box. So it's really exciting to see your engagement and all your questions. This is great. We're not going to be able to get to everyone's. We're at 1 o'clock now, and I want to be respectful of people's time, but I have them saved. And so in our follow-up messages to folks, we'll include the answers to these questions so that we don't leave you hanging. I want to thank all of the participants very much for joining us for this hour today on another Zoom interface. And I especially want to thank our panelists for their time and for offering their expertise in the intersection between public and environmental health. So thank you all very much for joining us. And we will be in touch both to answer these questions and also with the link to the recording for the webinar. So thank you very much. Lani, yep.
To evaluate, right? We're going to have
Yep, and that's right. Yeah, there'll be a short survey that you'll receive, and we'll ask you to complete that for us.
Thank you.
Thank you.
Thank you so much.
Thank you.